What is an EMR? When you hear that word, what do you think? Electronic medical records are digital-based records stored in a computer. My name is Caitlin Rourke, and I'm currently going to school to be a registered nurse. The main idea for electronic medical records is to eliminate those loose papers and introduce a computer-based system for every hospital and doctor's office. Electronic medical records will soon be mandatory. It will have to happen. Not only is it a great way for documenting and following up patients' care, but also storing important data. Imagine you were out of state, right? And you were rushed to the hospital and you need medical treatment. With a great ease of mind, you can walk into any hospital knowing that any doctor will be able to access full past history in just one touch of a finger. Who wouldn't want something that fast? And in a hospital, fast movement and thinking is number one key. So why should a doctor's office and hospitals have this electronic software? The first thing that pops up in my head is loose paper. Everybody at one point has lost a piece of paper. In a hospital, losing a piece of paper could mean a life or death situation. With computers, you never have to worry about papers getting mixed together or disappearing. Dealing with many papers is also time consuming. Working in a busy atmosphere, everything you have to do is in a time crunch. You need to make sure you're writing everything down the patient is saying and that it is clear and spelled correctly. This program is designed to make nurses less stressed and have a little bit of an easier work task. Soon we could say bye-bye paper. Paper-based records and electronic records is a great comparison to old school versus new school. Every hospital and doctor's office has that one person who doesn't like change. When introducing this software in the hospital, each database will be designed for every medical field in the beginning. I've heard the saying, people do not want to change what's still working for them. However, change is mandatory if you want to succeed in your field. I'm sure when I first mentioned electronic medical records, you were thinking, man, this must cost a lot. And you were correct. There's a large startup fee obtaining the software and training, but over the years you will be saving money using this software. With introducing this software, there are many other benefits such as confirming that you are taking the correct patient's file. Also, this software will have you make sure that you're putting the patient's social or date of birth that is correct to make any further decisions versus pulling a paper chart from the wrong person. With this technology, the database does not allow you to make any kind of these errors. After speaking to my aunt, who is a traveling nurse, I realized that she could not do her job as efficient as she does now with using paper files. She brings her laptop everywhere she goes, to every office or home visit. As all medical files are simply stored as the ease of a tiny laptop or an iPad. You will never see her without this. Another favorite benefit from electronic medical records is the health safety it has. Imagine you are a nurse sending over a patient's prescription. The computer now can monitor any medicine that cannot be combined. This will alert any doctor before he or she has even time to say goodbye to the patient. Another benefit is sending over our prescription to a local pharmacy. Less work for them makes patients like us happier. I've had my own experience with this myself. Having my prescription sent over to my pharmacy electronically took 5 minutes. Instead of having a paper file, no computer, the medicine was called in by the doctor, then called by the pharmacy, and took triple the time. Nobody wants that. Eventually, every practice, hospital, and healthcare facility in the United States will be using electronic medical records to keep track of the patient's information. Electronic medical records will help store and retrieve individual challenges and records. The emerging electronic fast care and decision making will have this software, everything you need in just a computer. The memories that I've had as a kid in being in a doctor's office is seeing aisles and aisles of vanilla folders. I'm sure every kid that I've talked to my age probably feels the same exact way. It is crazy to think my future child will never get to see this. In years to come, folders will be the thing in the past. I'm excited for the future, and I look forward to using this electronic medical records when I start in the hospital.